So, like I said, the pericardial sac for the most part is gone, but here's a little remnant of it, of that pericardial sac that would encase the entire heart, right? So, what layer is all of this?
The endocardium.
Not endo, but
Epicardium.
epicardium. Excellent. This is all epicardium. What is this?
It's the ear flap.
Good, it's the ear flap one, which is called the auricle. And what's the function of the auricles?
Tubal expansion.
Yeah, so when the atria fill up with blood, the auricle will allow the atria to expand. Okay, very good. So what is this?
Apex.
And up here?
Base.
This whole thing? Base. And what is, you won't know this probably, but it's okay. This is going to be your pulmonary trunk. Okay, so that is your pulmonary trunk right there.
Mm-hmm.
Now you should be able to see what at the entrance of it.
The pulmonary valve.
Good, the semilunar pulmonary valve, but you can on these, so obviously I won't test you on it. Just kind of know that that's where it would be, right here at the entrance of that pulmonary trunk. All right, let's open it up and see what we have. So when you make, the hearts are a little hard to dissect because they're wrapped, in that, the vacuum sealed bag. But what you want to do before you take it out of the bag, you want to massage it a little bit so it'll take shape. Like an avocado. Like an avocado. And then you're going to start with a scalpel at the base of the heart, and you're going to make an incision and go all the way down, all the way around, so that you can open it up like a book. Everybody's is going to look a little bit different depending on what size you have and the cut. But it's going to hopefully look something like this. So let's just look at this side first. Let's see if I can do this where everyone can see. What is this? This is the first thing you want to be able to identify.
The septum.
It is. It's the interventricular septum, which separates the left and the right. Now, which is the left side of the heart on this? There's two ways to tell.
First digit of your left hand.
Well,
The apex.
here's your apex, and where is it pointing?
Towards the left side.
It always points to the left, but if you're not sure, look at the wall. Look how thick this wall is compared to this. So you know that you're on the left side of the heart here. So what chamber am I in if I put my pointer there?
Left ventricle.
I'm in the left ventricle. Now look at this. This is your big papillary muscle. Remember we saw those on the picture that I showed you? Yeah, this is the big papillary muscle. And what's attached, what's anchored deep inside this papillary muscle? The chordae tendineae, or the heartstrings. And here we're looking at the valve. You know you're on the left side of the heart, so what's this valve attached to the chordae tendineae?
Tricuspid.
Or
The
mitral. Excellent. And that's the bicuspid or mitral valve right here. Okay. What would this be? This is going to be your left what?
Atrium.
Good, it's your left
I'm looking
atrium.
for Stephanie's phone over here.
Yeah. Okay, so if you get stuck, I know a lot of you suffer from test anxiety and you get a little nervous. If you can just remember that anything that is above the atrioventricular valves, you're going to be in the atria. Anything below that, you're still in the ventricle. Okay, so anything below this valve, you're in the ventricle. Does that make sense? Okay. Here is the trabeculae carnae that I was talking about. Do you see how it's kind of rigid there? You see it pretty good here too. Do you see the little ridges? That's the trabeculae carnae, and it's only found in the ventricles. Do you see the lines here? Trabeculae carnae. Now, you're probably wondering what this big muscle is, and I didn't mention it during the lecture because they didn't have a picture of it in the PowerPoint, but this is called the pectinate muscle. And I'm going to send you a list of the things I want you to identify, so look for it in notifications. But this is the pectinate muscle, and it's only found in the atria. So, and it does the same thing basically as the trabeculae carnae of the ventricles do. It helps with blood flow. Okay, that's pretty much the main function of those two. Let's see. On this side, what is this? It's just like this. It's just a little smaller. What kind of muscle is that? Starts with a P. Papillary. Papillary muscle. What's anchored into the papillary muscle? Chordae tendineae. We're on the right side of the heart. See how thin that wall is? So this is kind of chopped up a little bit, but trust me, it's an atrioventricular valve. Which one is it? We're on the right side of the heart. It is the tricuspid valve, Okay. So let's go back to the left side. And if I'm blood, if this pointer's blood, where am I? I'm in the left ventricle. Where did I just come from?
The right.
No. Left. I came from the left what?
Oh.
Yes, I came from the left atrium. So here's our left atrium. The blood is going to go through what valve?
The semilunar.
No.
Mitral.
The mitral valve or bicuspid. It's going to go into the ventricle. From the ventricle, where's the blood going? Do you remember? You said it.
Semilunar.
The aortic semilunar valve. And look at this nice aortic semilunar valve. You see how it looks like a cup? Does everyone see that? And it should be here on the bottom too. It's just a little worn. Do you see it? That's the semilunar aortic valve. So the blood is going to go through that, through the valve, and where to?
Aorta.
The aorta, whoops, which is right here. So that's your aorta. And then the blood is going to be pumped systemically throughout the rest of the body. Okay, so starting on the right side of the heart, if I'm blood, if the pointer's blood, first of all, what chamber of the heart am I in?
Right
Right
atrium.
side.
I'm in the right atrium. Now, where am I going? I'm blood. I'm leaving the right atrium, and what am I going through? What valve?
The tricuspid.
The tricuspid valve, and then I'm going into the
Right ventricle.
right ventricle. From the right ventricle, where am I going?
Pulmonary artery. No.
Well, I'm going to go through the pulmonary semilunar valve, and that's at the entrance of what?
Pulmonary trunk.
The pulmonary trunk, which is right here. This is the pulmonary trunk. So the blood's here. Now where am I going? I leave the pulmonary trunk and I go to the pulmonary arteries. I'm going to go to the lungs. And what's happening to the blood now? It's oxygenated. Now, where am I? If
Veins.
yes, the pulmonary veins is going to carry oxygenated blood to what?
The left atrium.
The left atrium. And it's going to go through what valve?
Bicuspid.
Bicuspid or mitral valve into the ventricle.
And then back up to the
And then from the ventricle, it's going to go through the entrance of the aorta, which is that aortic semilunar valve. And then it's going to go through the aorta and then it's going to be pumped systemically throughout the rest of the body. And then what happens? It starts all over again with the superior inferior vena cava, which will carry deoxygenated blood to the right atrium. And it just keeps going like that over and over and over. Okay. Any questions? I do want to point out something. I'm not going to test you on this at all, but do you see this structure here? We only see this on the right side of the heart, and it's called a moderator band. And basically, this moderator band is kind of a landmark for when we're looking at fetuses. And it kind of tells us where we're at because, when we're looking at fetuses, they're so tiny, right? And so this is a really cool landmark. I don't think anyone will ever ask you that, but if they do, you'll know what it is. And it's only on the right side of the heart, and it's basically used as a landmark when we're doing ultrasounds and things like that for fetuses. Okay. All right, guys.